So as a surgeon, I often feel that it's hard to let a trainee do a lot of the operation if it's going to take a lot longer because we're under that bit more pressure to get more patients through.
With virtual reality training and moving forward, you can get reps. We don't have all the haptic responses of feel, but that's what your last couple of years in practice are, and that's what your mentors are for, is to teach you the tips and tricks of tissue tension and retraction. But the steps should be roped. It's easy to do when it's in VR training versus just on a cadaver. But essentially, it's also cheaper. It's just reps. Most of surgery is reps once you learn the anatomy.
So I think it's very important to include VR in the curriculum of surgical training. It's not going to supplant, it's going to add. We can repeat over and over and over again in the comfort of your own home, rather than getting on an airplane or going to a lab. Three-dimensional learning versus two-dimensional learning, just watching videos, for example, and then getting the manual dexterity, the haptics of understanding of how it feels in space when you're physically doing the surgery, and being able to get those multiple reps to get you to the point where you're comfortable with the surgery.
My first impression about using VR Precision was that it's an excellent learning tool because you feel like you're doing the procedure in operating theater. That makes it easier when you go into the operating room to do the same procedure on a live patient.
Pick up the drill from the tray. Pull the trigger and push forward to drill the near cortex through the small drill guide.